Give it one more minute and then we'll get going.
Hi, Lisa.
All right, guys, we're going to get started here, and then people will join as they may. So, good afternoon. Thank you all for joining us for our Lunch and Learn series. My name is Vin, and I'm a physical therapist with Elite Health Services. Today, we're going to be reviewing breathing techniques that are useful for rebalancing our nervous system. So, I think a good way to kick us off is talking about some fun facts about our respiratory system. So, 21% of the air we breathe in is made up of oxygen, but our body only needs 5%. And I find that pretty fascinating because oftentimes we're always talking about oxygen, how much oxygen can we get in? But a lot of the respiratory system is built upon managing our carbon dioxide levels. So we breathe in oxygen and we breathe out carbon dioxide to keep our metabolic system pretty level throughout the day, or we can also call it our homeostatic balance. Humans take about 17,000 to 20,000 breaths a day. And that leads us pretty much into why we're doing what we're doing today, because we should have a breath practice. Because we do it so often and so much throughout the day, we want to make sure we're as efficient as we possibly can be. And if we're not there yet, we should have tools in our toolbox to try to get there. Having a breath practice has been proven to be effective in reducing stress, reducing anxiety, and also reducing pain levels. And it's also been shown to be helpful in improving our lymphatic system, which is basically our waste management system of our body. It's been shown to improve our sleep quality and then overall health and performance. So today we're going to be focusing on two aspects of our breathing. First, we're just going to work on creating a proper sequence in through the nose, out through the mouth. And basically, when we're working through this, we're going to work with our mouth closed and our tongue on the roof of our mouth, but we're not going to be biting down on our teeth, okay? The second component of what we're going to work on is using our diaphragm. Our diaphragm is one of our main respiratory muscles, and it sits right below the bottom of our rib cage. And if you have an efficient diaphragm, it should be domed, okay? What we often find with our clients is because of the environment we live in and the stressful jobs we have or lack of sleep, poor diet, and the list goes on, we find that the diaphragm typically starts to flatten out because we don't use it as much. And the diaphragm is not as efficient when it starts to flatten out, and it actually starts to become an expiratory muscle as opposed to an inspiratory muscle when that flattening happens. So we want to do our best to use it as much as we can so we keep the proper shape. So what we're going to start off with today is just a body scan. And what I'd like you all to do, if you can, sit on the ground, cross-legged. If you're in a chair, that's fine as well. And basically, I'm just going to talk you through what I want you to feel in your body. And just keep those eyes closed. And we're going to start off at the face. So let's start off with both eyebrows, okay? To try and notice is, does one feel heavier? Does one feel tighter? Is there any pain in that part of your face? Okay, so start to notice these things and pick up them and take note, because when we're done, we're going to reassess to see if any of the breathing helped that. And now we're going to move down the face a little bit, thinking about our cheekbones right beneath our eyes. Does one cheek feel higher, lower, tighter, more pressure, potential pain? And then just keep reciting that back to you. Keep it in the back of your mind. And now we're going to move down to our neck. Does one side feel tighter? You feel like your shoulders pulling on one side of your neck versus the other? Do you have any pain? And now we're starting to move down into our shoulders. Okay, we can throw the shoulder blades in there too. Do you feel anything in the back, or do you feel more pain in the front or tightness in the front or back? Okay. And now let's just move to our breath. Think about your thoracic region, your abdomen. How hard are you working to get that breath in? Are you using your mouth? Are you using your nose to get the air in? Keep note of if one side feels tighter or looser. Okay, because remember, we're going to come back to this. Okay, take another 2 breaths there, and then we'll finish it up. And then we'll move in onto our first breathing technique. So our first breathing technique is called alternate nasal breathing. Our body has a system called the autonomic nervous system. And basically what that deals with is everything we don't want to think about throughout the day. And alternate nasal breathing has been shown to be effective in keeping that balance within that system. You may have heard it as the parasympathetic nervous system versus the sympathetic nervous system, or fight or flight versus rest and digest. Both have their benefits and drawbacks, so we want to try and keep as best of a balance as we can. Nasal breathing is one of the ways we can do that. So what you're going to do is, okay, you're going to create a hand motion like this. I'm not too great at it, so I have to use my other hand to put it where it should be, okay? And what we're going to do is we're going to start, and I'm using my right hand here, we're going to start by occluding our left nostril. Now, don't yank your nose all the way to the side, the right side. Just put enough pressure so no air can get into that left nostril, okay? And when you're ready, we're going to take a nice deep breath in through that right nostril. Breathe in. Hold it. And now occlude your right nostril with your thumb. Let go of the left and breathe out through the left nostril. And now you're going to breathe in through that left nostril. Hold it. Occlude the left. And now breathe out through the right. You probably hear me, my left's a little occluded. Stuffy today. And now we're going to breathe back in through that right. Hold it. And now occlude the right nostril and breathe out through the left. And last rep here, let's breathe in through the left nostril again. Hold it, occlude the left, and breathe out through the right. Excellent. Take a little break. Sometimes that can be a little stressful. On this next set, we're going to repeat that again. I want you to really pay attention to if one side feels more blocked than the other. Okay. Obviously, our body's always going to have some disparities between sides, and that's fine. What we're looking for are those big, obvious differences. You know, and that's something myself and my colleagues work on with our patients, is identifying how big of an impact their nasal system or even their mouth is having on their overall respiratory system and their ability to breathe properly. And we do work with professionals that help, you know, get that person the right care to address that system in whatever way it needs to be. Okay, so really pay attention on this next set where you feel like you need more work or which side feels a little bit more occluded. We're going to make that hand position again, and we're going to occlude that right side with the thumb, and then breathe deep in through that left nostril. Hold it, occlude the left nostril, and breathe out through the right. Let's go again here through the right nostril. Hold it, occlude the right. Breathe out through the left. And now in through the left. Occlude, hold, and breathe out through the right. We'll go one more round here. Breathe in through the right nostril. Occlude the right and breathe out through the left. Excellent. Now breathe in through the left one more time. Include the left and out through the right. Good job, guys. So we're going to do one more technique here. If you don't have a couch or a stool, that's fine. You can lay on your back with your knees bent. Preferably, I would like you guys to get into this position with your knees bent to 90 degrees and your hips bent to 90 degrees and your legs supported on a chair or a couch. And I'll give you guys a second or two to just get set up there. If you have any neck pain and you feel like you need some support through your head, that's fine. Okay, so now that we're all set up, let's place our left hand on our tummies and our right hand on our chest. And all I want to do is start off with 2 easy breaths here. And what you should be paying attention to is, do you feel your right hand, which is your top hand, going up more or less than your bottom hand? And that'll kind of clue you in as to whether you're using your diaphragm enough or more or less than you should be. So again, right hand on top, left hand on the tummy. And what I would like you to do is just take 2 breaths in on my count. Let's breathe in here. Hold it and breathe out. And then one more time. Breathe in and breathe out. Excellent. So just keep in the back of your mind if you felt like your chest was going up more than your tummy hand. And if that's the case, you're probably using your upper chest a little bit more than you are your diaphragm. For the next sequence, I'm going to want you to make that belly rise a little bit more. And what you're going to do here is you're going to apply a slight pressure with your left hand into your tummy, okay? And when you do that and take that breath in, your belly should match the pressure of your hand. This way we know the air is being brought in through the use of the diaphragm, okay? So let's start by closing our mouths. Make sure we're not biting down on our teeth. Let's rest the tongues on the roof of our mouth. Slight pressure into the abdomen and breathe in and match that pressure and go. Hold it. And now breathe out like you're blowing out birthday candles. All the way, keep going and hold that breath out. Don't breathe back in yet. Keep that pressure on the abdomen and breathe back in. Good. Hold that there. 3, 2, 1. And now breathe out. Push that air out of your body like you're blowing out birthday candles. Good. Hold it. 2 more reps here. Let's breathe in against the hand. Hold it. 3, 2, 1. Now breathe out. All the way. Keep blowing out. And last one. Breathe in. Hold it. 3, 2, 1. Blow all the way out. Good. And that expiration is really what's going to help us get that dome back in our diaphragm, okay, by bringing our rib cage down. We're going to repeat this one more time, except we're going to do it a bit differently. And what we're going to change here is we're not going to take as big of a breath in. So follow my count on when I say to breathe in, and then I'm going to tell you to stop, okay? So let's get in position, and let's take a breath in the same way we did before. Breathe in and stop. Hold it. And now breathe out for longer this time on my count. Breathe out. 4, 3, 2, 1. Hold it there. Small breath in. Stop. Hold that breath. And now breathe back out for a count of 4. 4, 3, 2, 1. Hold it. Hold that breath out. Again, short breath in. Stop. Hold it. And now breathe all the way out. 4 count here. 3, 2, and 1. Last one, small breath. Breathe in. Hold it. And then 4 breath out. 4 count out and out. 4, 3, 2, and 1. Break. Excellent. Let's come sit back up. And we're going to run through that body scan again, everybody. And now that's a great way to get your diaphragm. Obviously, that is not the only way we want you breathing, but it's an excellent way to focus on the diaphragm. And once you get that down pretty good, you can progress that breathing, okay? So that's just baseline. So let's close your eyes again here. Let's run through that assessment of our body and keep in mind what you felt at the beginning of all this and just note if you had any changes, okay? Let's start back up with the face, with the eyebrows, comparing right to left, left to right, heaviness, pain, tightness. Moving down to the cheekbones, same thing. Differences side to side, differences before and after. Good, and now let's go down to the neck and jaw. Same thing, any differences pre and post, any differences side to side. Did anything potentially get worse? Did something get tighter? Maybe you weren't activating the diaphragm as you should have been, and that's always a potential as well. And it's a good cue for you to know whether you're doing something wrong or right. Moving down to the shoulders and the abdomen here. Changes right to left, tightness, pain or pressure. And your breathing, is it a little easier to breathe now? Less work. That one tight spot is not as tight. Okay, everybody. Thanks for joining us today. Does anybody have any questions?
Excellent.
All right, everybody. Well, thanks for coming. And Thursday, we're on again at 1:30 and 5 o'clock, and we'll be talking about primal movements.
Woohoo.